diseases.
And to neighboring Enugu State, where Governor Peter Omba says his administration is prepared to bridge the gap created by inadequate health infrastructure, access to quality healthcare, manpower, with the construction of a functional Type 2 primary hospitals across the 260 political wards in Enugu State. He said this at the inspection and stakeholders engagement of one of the Type 2 primary healthcare centers at Ituku Emene. Senior reporter Bamidele Ajayi, TVC reports.
Thank you, Dan. Thank you, Dan.
The world has made significant strides in improving primary health care services for women, men, children, and adolescents. But inequities within countries persist, especially in low and middle income countries, where millions of people still do not have access to quality health care services. In some places, health facilities are too far or expensive to reach. In others, facilities lack medical supplies or trained personnel necessary to deliver essential and quality healthcare services. Access to quality primary healthcare system is critical to Governor Peter Omba-led administration, hence the massive investment in primary, secondary, tertiary health institutions in the state. The traditional law of Emene community describe the healthcare services its people access from the newly constructed Type 2 Health Center as unprecedented.
The health facilities that are around are owned by individuals and run at exorbitant prices, more than the community can afford. So we are very happy with the establishment of the primary health center here.
The situation was corroborated by the council chairman, who announced placing 5,000 people from the council area on health insurance scheme.
In fact, in trying to link to this goodwill of you, here in this ground, we launched the inclusion of 5,000 residents of Enugu's people into the universal healthcare coverage.
WHO representatives and its NMA counterpart outlined the key focus of provision of quality healthcare services at the grassroots.
Your Excellency, WHO especially commend you for these bold reforms to reposition the health sector in Enugu State.
Governor Peter Omba emphasizes the zeal behind this project, which aims to achieve zero infant and maternal mortality, announcing plans to build another Type 3 primary healthcare facility in the area to accommodate the surging population.
We want to make sure that the staff, have no reason to say they are not here because there is no money for transportation. So that's why we have staff quarters in each Type 2 primary healthcare center. And there is access to sanitation and hygiene. So for every Type 2 primary healthcare you have in the state, you have access to that.
The governor had a tour of the facility to witness the operation, where he was shown 2 women who delivered in the health center. Bamidele Ajayi, TVC News Emene.
And you're watching TVC News at 1. We'll take a break now and return with more stories in a moment. Stay with us.